Good afternoon, and thank you, Governor. So I want to give a brief update in terms of the numbers for what we're seeing in New Hampshire for COVID-19, and then some additional public health recommendations for our communities. So to date, over the last 3 weeks, since our public health laboratory first brought on COVID-19 testing, our public health laboratories has tested over 2,400 people for COVID-19, and there are an additional 870 tests pending currently. So we have certainly ramped up testing for COVID-19 in our state. We are now announcing 101 individuals with COVID-19. That's an increase of 23 individuals from what we announced yesterday, and we will continue to release daily updates. The majority of these individuals are travel-related, either domestic or international travel-related, but we are seeing a number of individuals in various communities and counties throughout the state who have no clearly identified risk factors of contact with a confirmed COVID-19 case or travel. And this indicates that there is and continues to be community transmission of COVID-19 in multiple areas of our state. 11 individuals have been hospitalized with this disease. And I have the unfortunate news that today we're announcing the first individual in New Hampshire who has died from COVID-19, and I want to express our sympathies for the family and friends of this individual. This is an unfortunate situation and one that we certainly want to try and avoid, but we know that with this virus it can cause serious illness and even death in those who are more susceptible to serious infection. This individual that passed away over the weekend was an adult male who was over the age of 60 from Hillsborough County and had multiple underlying chronic health conditions. This is the exact group of individuals that is at highest risk for serious COVID-19 related complications such as hospitalization and even death. So I want to use this opportunity also to acknowledge that as a community, we need to do what we can to protect the more vulnerable individuals in our communities. And to Governor Sununu's point, we want to stress the importance of social distancing. Now, what does that mean? Social distancing means that people, when they are out, should maintain a distance of at least 6 feet from other people around them. If someone doesn't need to go out for an urgent or emergent issue, we encourage them certainly to stay home and certainly away from public gatherings of individuals. We know that many people are already doing this, but we want to stress again the importance of social distancing as a mechanism to slow the spread of COVID-19. As you've heard over the weekend and today, we have an increasing number of cases. This is expected and can be expected to increase in the coming days. And so we ask that everybody in their communities do what they can to limit the spread of this virus and protect those who are more vulnerable in our communities, for more vulnerable to serious complications of infection. I want to also acknowledge a question that we get often about whether somebody can potentially transmit the virus early in the onset of symptoms and possibly pre-symptomatically or asymptomatically transmit the virus. And I want to acknowledge that there does appear to be increasing evidence that this happens and potentially is one of the drivers of this pandemic. And for that reason, if someone has been exposed to another person with COVID-19, meaning they're a close contact, whether that person is confirmed to have COVID-19 or suspected to have COVID-19, those individuals need to take the extra step of staying at home and quarantining themselves to prevent further spread in our communities. We have stressed before the importance of anybody who has even mild symptoms of staying home. That remains the case. We also want to stress the importance of people that may be asked to quarantine at home, meaning stay at home, because of potential exposure, that those individuals please do so. I want a couple additional points here. Anybody that is more vulnerable to COVID-19, so people that are 60 years of age and older, or people with multiple chronic medical conditions, we want to ask those individuals especially to stay home as much as possible, limit contact with others. As the number of people with COVID-19 increases in our communities, the risk of acquiring this from our communities is increasing, and so these individuals particularly need to pay particular attention to remaining at home and practicing social distancing. And again, that is maintaining at least 6 feet, being within 6 feet of other people, avoiding being within 6 feet of other people, and staying home as much as possible. For these individuals, we encourage them to have at least a month's supply of medications on hand, and a supply of food and groceries. In these times, we also ask community members to reach out and support others in our community who may need a hand, who may need to make a trip to the grocery store, but are trying to limit their social outings. We encourage people in our communities to look around and reach out to others to see how we can best support those who we want to certainly protect. Finally, let me just mention that there are more than 350,000 cases of COVID-19 globally, and now more than 35,000 cases of COVID-19 in the United States. Right, so this is a virus that is rapidly increasing globally and in the United States. The United States is now the third highest country in terms of number of cases of COVID-19. So it's no longer just international travel that poses a risk to people acquiring COVID-19. We have a number of individuals who have traveled domestically and have come back to New Hampshire with COVID-19, and certainly, as you've heard, people can even acquire COVID-19 within our own communities. So we want to encourage people to the greatest extent possible that they avoid any domestic or international travel, especially if this is travel on public conveyances like buses and airplanes and trains. This is particularly important for those who may be over the age of 60 and people with multiple chronic medical conditions. Finally, I just want to say that, again, we expect the numbers to increase in the coming weeks. We are taking what I believe to be appropriate and aggressive action for trying to limit community transmission, but we need to, all of us collectively, take steps to distance ourselves from others, which can be stressful and potentially isolating. So we need to find ways, I think, to support each other in our communities, but we can expect to see COVID-19 increase in our communities, and we will continue to work with our local partners to try and mitigate the impacts of this virus in the coming days and weeks, and we're watching this and responding, watching the situation very closely and responding in turn. Thank you.